Good morning, everyone. Welcome to Chiang Mai. Today, we will begin the course short training program on the collaborative and development of health system, how to strengthen the capacity of public health personnel during the COVID-19 pandemic. Today, I will share with you about the healthcare system and the policy in Thailand. You may have known that Thailand is one of the countries that well prepared and respond to the pandemic quite well in Asia. My name is Associate Professor Vilawan Senaratana. I'm a retired faculty member, but all along, I have done the research in the area of the health system since maybe 20 years back, just before the reform of the country reform. Therefore, I still continue doing my research. So things that I will share with you today is about the evolution, about what happened in Thailand, why we have a strong health system in the country. So if there is anything you would like to share, you would like to ask when you are watching my topic, we can discuss that at the end. So the presentation that I will share with you today is about I will begin with the health and factor related to health, and then the demographic data of Thailand, evolution of the health system in Thailand, human resource for healthcare system, and the Thailand health insurance system, and healthcare system in Thailand. And the last one will be the emergency situation in healthcare system, which will be the COVID-19 pandemic. How we respond to that, what is the strength, what is the weakness, and how do we handle that, okay? Of course, everyone probably know about health is the state of complete physical, mental, social, and spiritual well-being, not merely absence of disease and infirmity. This is WHO definition of health. But for Thailand, according to our National Health Act, health is the state of human being which is perfect in physical, mental, spiritual, and social aspects, of all of which are holistic and in balance. This is for Thailand. Thai National Health Act. And then the factor related to health, as everyone may already know that health got affected by many factors, not only physical factor, but of course the environment, the social. For each person, that means individual. The behavior is the most important, health behavior, and the genetic beliefs, the spirituality. Genetic is like maybe related with thalassemia, or maybe some people say maybe cancers or diabetes, but behavior is the most important one. The belief is also affected to health. Belief in something, belief not to eat the protein, or belief in the health tribe group, that may affect their health as well. The spirituality, that's also affected. The environment, there are a lot of impact to health for the environment, such as Thailand or Chiang Mai especially, the smog or PM 2.5 from the burning the forest to get the special kind of mushroom and also cause the PM rising. The environment is the economic impact also. For example, when they're using lots of chemical substance, that's also related to the politics. The culture, the religion, the education. It doesn't mean that when people have high education, they will have a better health. It's not true. The security of the system, the welfare system, like Thailand, we will talk later about the health insurance for the country. Health for all for health. The communication and transportation, you already understand that. I'm not gonna explain more on that. If you do have anything to share, we can share at the end of the session. Technology impact a lot, especially during pandemic of COVID-19. There are many innovation, many kind of innovation and involvement from the different company, health, educational institution have developed several to help personnel to handle with the COVID-19. And the coverage, the health system is another factors. So the third factor and the most important also is the healthcare system, because long years ago people did not get access to healthcare, and that make them inequity to healthcare. The quality of healthcare is also important. So all of these healthcare system, both public and private may be, people may like the private one, but the cost is quite high. Not everyone can get access to private healthcare in the country. So if the health system change due to the environment, due to the individual, the health situation, so these three are related to each other. If one factor change, it will has an impact with another factors as well. So all three are affected to health of the people. Oh, sorry about that. Okay, according to the demographic data, the end of December last year, 2019, Thailand has the total of 66 million population. So male and female. Female is a little bit slightly more than male. But this is the population according to age, sex. Below 15 years, the total of 11 million. The working age, 15 to 59, is 43 million. And elderly means 60 to onward, 60 up. So made it about 18 or 19 million. But if you compare that, the working age and the elderly is also in good shape. Not really good, but they can take care of their parents. When we go to the health statistic, the growth birth rate is per 1,000 population is 10.5. The crude death rate is 8.1. The infant mortality rate is 9.3. So, but many places, this is an average of the country, but many places the birth rate is very low because they don't want to have many children. They said it's too expensive to have one child. Now I'm going on to the evolution of the Thai health system. Actually, Thai health system began long years ago, nearly 200 years ago. King Rama III started the Western medicine, and then Sri Raj Hospital is the first hospital that established in the country. This abbreviation it's explained at the bottom of this PowerPoint. In 1918, the Department of Public Health was established. The MOPH, Ministry of Public Health, then established in 1942. The nursing college, the first nursing college, established in 1946. The mandatory rural service, 1968, before primary health care. Before, people did not get access to health care, especially in the rural area. Due to the transportation, it's not convenient. They probably have to walk many days to get to the hospital. So when they are sick, there's no car. You have to carry people to the hospital, which takes many days. So some of them just die off. Actually, Thailand have tried to improve the health care system before primary health care around 1972, 75, scaling up district health system. And then during primary health care onward, it was a rapid evolution of the healthcare system. In 1978, Health for All, by the year 2000, everyone, the WHO member country, participate in that. And also everyone is trying to working towards Health for All by the year 2000. Thailand have established primary health care before the announcement of WHO, maybe 1975. So we experienced that, and we carry on until 2000 still. We may not achieve health for all 100%, but many lessons was learned from the implementing primary health care in the country. In 1992, Health Research Institute was established. And also it's a decade of health center development. Health center development trying to every sub-district will have one health center. So we are trying to cover all sub-district must have the health center. So people can go and access to the the primary health care, primary care. And 1990, the Constitution the economic crisis, the 1990 economic crisis, and 1997, the health constitution was passed. So these are many, I will talk in detail in the next slides about the National Health Commission Office, the local Thai Health Fund, and the Emergency Medical Institute of Thailand, and the Hospital Accreditation Institute. This is all the institute that improve the quality of healthcare. I will explain in the next PowerPoint. So we reform our healthcare because of the health is separate system, not a holistic focus. Like health is just a part of. It's not a holistic. It's not integration. They're not focused on biomedical health system, not biosocial health system. If you talk about the factor related to health, it's not only biomedical, but it's also biopsychosocial. And then the health issue and the disease has been changed. Therefore, the health system needs to be reformed. The issue in quality and accessibility of healthcare. Before, we usually emphasize on curative, which is a very high cost, instead of prevention and promotion. Emphasis on curative, because wait till people get sick, come to the hospital, and you treat them. And that's very costly. So this needs to be reformed. And also the previous health system, lack of or limitation of the participation of the people. This is the person who influenced the change or the healthcare reform in the country. Professor Emeritus Dr. Pravet Vasi. He using the reform process, the triangle that moves the mountain. This is his concepts. First, you must building the knowledge by doing research, by getting the participation from the people at the area, at the community level. And then after you got a knowledge, and then you must using that knowledge. If you remember I go back a little bit. Health System Research Institute was established in 1992. This institute is the institute that developed the knowledge for the healthcare reform. After this institute have a new knowledge by research and by participation of the people involved, then the knowledge building from this go to the social mobilization. So let the people understand the new knowledge, the knowledge that for healthcare reform. So this social mobilization by using the knowledge here, and then from this, the knowledge and the people understand, and then we propose get the public involved, the political support to make a country policy. So we call this as the triangle that moves the mountain by Dr. Pravet Vasi. The paradigm shift in healthcare. This is in detail of why healthcare reform is needed, because the chronic condition describe all health problems that persist across the time require some degree of healthcare management, such as we have more of diabetes, heart disease, depression, schizophrenia. During that time, HIV/AIDS is also the substance abuse and ongoing physical impairment. And this is about the chronic disease. The hospital-based care, the population focus on healthcare system for chronic condition. They seeking for to go to seek patient care to some unit. This using more resources, the quality of care and health outcome in the population which is well known and well understand medical service. This approach reduces the need for high cost, high intensity. So when hospital-based, as you already know, medical treatment, hospital care, it's quite costly. So we should move on to the community-based care instead of hospital-based care. When we move to community-based care, that means we need to strengthen our prevention and promotion. So from cure, we should go to prevention focus. So reduce the risk of health factors. So people need to do more prevention and promotion than cure. And it's a lot cheaper than cure. The quantity, from quantity to quality focus. From doing it by each organization, each partners, to be integration, coordination, and continuity across all categories of chronic condition. From things that you used to do in routine, do it more flexibility, adaptable. So do more surveillance, monitoring, evaluation, changing in context. Biomedical approach to biopsychosocial approach to cover the factor related to health. Just shift from medical service. Shift from medical service to public health service. Public health is medical service. It's part of public health service. That's why public health is more important. That's why we need to develop the holistic care. That means the public health, including medical service in there, not only medical service, to cover biopsychosocial approach. This is the chronological of evolution of Thai health system. In 1992, the Health System Research Institute was established. And in 1997, Thailand had a new constitution. By 2000, established the National Health System Reform Office. The Health System Reform Office is the office that, using the knowledge from Health System Research Institute for the social, the forum for the people to understand. So this office from HSRI, Health System Research Institute, got a new knowledge and referred to the National Health System Reform Office to share with the people establish the forum, which is I will talk after this. See, 2000 and 2002, more than 100 public forums were held nationwide. Why do we need to hold the public forum? We are trying to get to listen to the people. We are trying to share the knowledge that was developed by Health System Research Institute. And then after so many public forums were held, the network of the district, province also organized the local forum, the district forum. And after this forum, we synthesized the draft National Health Bill. So if you remember, we were saying that before the health system, it's a less participation of the people. So this time we are trying to get more participation of the people at different levels, and then we synthesize the draft National Health Bill to propose to the government. In December 2002, National Health Bill was accepted for consideration by the cabinet. But it's not that easy. We wait for so many years. 2002, they accept for consideration. During 2002 to 2005, several forums and sessions of Health Assembly were held and follow up the review of the major issues that we proposed to the National Health Bill and revise it. They start the first reading on 2005, December. In February 2006, it was the dissolution of the parliament, and the National Health Bill have to wait for the following House of Representatives. So that's not possible. 2006, there was a coup, which is result in the dropping of the National Health Bill. That means the National Health Bill was dropped. So it's gonna take a little time. By March 2000, the establishment of National Health System Reform Commission and National Health System Reform to get the reform function, to follow up, to make it to pass the bill within 3 years' time. But from 2002 proposed, 2005 they read, and 2006 there was a coup, so it was dropped. So what happened next? 2007, the National Health Bill was deliberated by the National Legislative Assembly. And it's the second passed into law and its third reading. So proposed in 2002, 2006 was the coup. Then 2007 continued, and it was accepted by March 2007. National Health Act was published in the Government Gazette. Okay. When the bill was passed, that's why National Health Commission Office here, the National Health Commission Office was then established. So the health system in Thailand composed of the healthcare institution, healthcare resource, healthcare management, healthcare services. And the goal of the healthcare system is to maximize the quality of healthcare. I think it's like other countries as well. To minimize the expenditure on the healthcare costs, to achieve equitable distribution of quality healthcare, and the burden of costs.